Welcome, everyone. First of all, excuse me for my voice. I've lost a bit of it, and welcome to these States. We are happy to be talking today about how we are transforming healthcare with digital innovation. We are in states where many experts come to discuss how digital healthcare is transforming how we live. We are all patients, or we will be patients in the future, and we need to speak with the experts in order to understand how this arena is evolving, how artificial intelligence can impact one of the most important and diseases as cardiovascular health is, with a huge impact and burden of disease in the world, and how technologies are transforming the way we live cardiovascular health. When we talk about that, and we will know about it through Dr. Marina, who's going to speak a lot about huge solution that is transforming healthcare nowadays, we will also need to tackle the framework, how we are regulating, how we are transforming health in all policies, how we are bringing healthcare to all the discussion tables, and how we are bringing artificial intelligence and other digital tools to a reality through a strategic discussion. For that, we have Silvia with us today, and we will start talking about how we are collaborating, how we establish partnerships, and how are you trying to use partnerships in order to make the change happen. So welcome to the States, Manu, Silvia.
Thank you.
And please go ahead. How is partnership changing the world of healthcare?
You want to go?
Well, how is the partnership changing everything? If we think about the European Commission and we think about the OECD, I think it's the key, because the partnership is what is getting everyone to collaborate, to innovate together, to invest, to define new policies, and of course in the healthcare system, to define a framework that could make things happen.
So let's say European Commission, OECD are there to provide us with a framework on how to interact, on how to partner with each other, how public and private collaboration should be made. And then it comes to a specific example.
Yeah.
Manu is a cardiologist, and he comes with a solution on AI. Maybe you can explain, Manu, what is this AI solution doing, and how you're using partnership in order to boost the impact of this solution in the healthcare system.
Thank you. Yeah, we started 5 years ago. We came here for the first time 5 years ago. And the problem that I saw at the hospital, I was working at the hospital before that, it was like doctors, we cardiologists, we are doing repetitive tasks every single day that can be automated, that can be, you can build algorithms and you can build software that can change the way we work. That was the idea, and we saw the power of code. My co-founder is an engineer, and we were writing lines of code to be able to automate the tasks that I was doing at the hospital. And looking around, all the cardiologists at my hospital were doing the same. All the doctors in the world were doing that same task the same way. And it was very qualified professionals doing the tasks. And what we tried to build was a software as a service model, so an artificial intelligence. It's called Willem. It lives in the cloud. You send the data to a cloud. We process the data and we send the diagnosis back. That's what we do, is kind of trying to support doctors diagnosing patients. As Cesar said, it's the first cause of death in the world, cardiovascular disease. And what we do is the reading of the electrocardiogram, which is the first complementary test that is performed in every single patient. Anytime there is a heart check and you are checking the heart, you are performing this test, and that's what we are processing. So it's an AI and a foundational model to process signals from the heart. That's what we do. The value of partnership of that is our AI is trained with real data from real patients. Mm-hmm. And those data are at the hospital. Those patients are, you need the consent from the patient and the consent from the hospital, from those doctors working with them and diagnosing them. So it's all about that, about a group of engineers, a group of cardiologists working together with all those research institutions and all those doctors and all those hospitals in Europe and also outside Europe to train our AI. Today we have more than 500,000 patients, and we are training every week using those real data from them, and those health data are saving more and more lives, so it's exponential.
So we could say there is an ecosystem of healthcare data. Maybe we can invite the audience to imagine partnership in healthcare as two layers. There is one layer, which is the one we are representing here, which is startups, academia, companies, and of course, individuals who want to change how the first cause of death, cardiovascular health, is impacting the world. There is this first layer on how we interact, but then there is a second layer, which is more profound, and it has to be with how we share our data. All of us, as individuals, we are the owners of our own healthcare data in Europe. But there are many things that we need to do in order to establish an ecosystem to share the data and be able to implement these kind of solutions. Solutions that are able to take an electrocardiogram and through AI tell you and help you as a healthcare professional what is the pathology that you're seeing this day in the outpatient clinic. Me, as a medical doctor, I am surprised. I am, I would say, flabbergasted of what the technologies are able to do in the healthcare system. But this second layer is not easy to tackle, Silvia. What are the trends? What is the challenge within this second layer of health data space? How we establish ecosystems in this second layer of health data space?
Well, how is the European Union or how is the OECD establishing this kind of collaboration and this kind of framework for everything, let's say? I will highlight two kind of initiatives. The first one is events. Very clear. I have one example here. The Health Innovation Policy Forum. It's open to everyone, and if we want to know what's happening, let's go. It's there, it's free, let's go. We can say, I don't know what's going on. Open your eyes, take notes, and go there, attend. It's also for you. And the second
So those sessions are open for everybody, and we can, you as an expert in the European Commission and OECD, you invite us to attend and learn what is going on.
They publish everything. I'm working with them, with the artificial intelligence, and also with the immersive experiences group in the Global Forum on Technology, and everything
is open.
It's open. So, but you can say, I don't know what's going on. Go to the webpage and read. And the second one is the collaborative project and partnerships. I have also one example here. And this works with both private and public organisms. And one example is the European Partnership for Transforming the Health and Care Systems. Those initiatives are there. Do we know them? But they are working, so we want to be involved. We want to get advantage of them. Let's open our eyes and let's go there.
That's a really good point, Silvia. How many people in the audience are collaborating in a partnership in order to transform on their field? It might be healthcare, but it might be any other, automotive, any other. Please raise your hand if you are collaborating in a partnership. Are you working alone or are you working together with others? Let's see the hands in order to know if you're... Okay, so there are not so many people working in partnerships here. Maybe we can bring some examples, Silvia and Manu, on the partnerships that you are working in. I don't know, Silvia, Manu, you want to share?
I have one example.
Let's go for
the other one, I will not talk about it because Manu is here and is the person who really could do it. The first one is JACARD, Joint European Action on Cardiovascular Diseases and Diabetes. 76 partners involved, 53 million euros. We are not, well, we all should be there working. And the other one is Assist, but I think Manuel is the best one to talk to us about it.
So Manuel, sometimes I think when startups listen to those partnerships, those millionaire investments, they don't feel part of it. How can a startup join a consortium and collaborate in a partnership? And which is the one that you want to share with us today?
Okay. So since the beginning, we were coming from a research background, and we were used to do research collaborations with research institutions, with hospitals in Europe, right? So we were comfortable there, and two of the founders were used to do that. And this is very powerful in healthcare. What you need is to be able to interact with public and private institutions like AstraZeneca or like leading hospitals in Europe, and to be able to train the technology if it's an AI that needs data to be trained, to validate the technology, to go through the regulatory process and get the CE mark clearance, FDA clearance, to be able to sell your software as a medical device in those markets. And you need to generate the trust from a scientific method standpoint. The scientific method is one of the most powerful tools we have as human beings. We are here today and we use all the technology because someone was using the scientific method to validate this kind of technology, and this is what has shaped our world since the beginning. This scientific method is what is needed in any health tech company, and those partnerships, one of them is a very nice one that we are doing, which is Faithful Project, for example, as it's another one. It's grants from the European Commission and from AIT Health, and where we are consortiums of 14 institutions, each of them. We are leading, as Eindhoven, some of those consortiums. In other consortiums that are not those ones, we are not leading, and they are Sorbonne University leading or another institution leading. In Faithful, what we are doing is to try to find those patients with heart failure that are undiagnosed and untreated. So there is 30% of patients with heart failure undiagnosed and untreated. If you integrate with primary care setups and you help those doctors to find those patients, you can improve the life of those patients, you can reduce the cost. We are talking about 83 million a year, of course, in Madrid, just in Madrid, 83 million. In Spain, it's 400 million of cost. Just those patients in those patient journey, which is heart failure, 400 million a year in Madrid, of undiagnosed. You go to the hospital, you are admitted at the hospital, and it's very expensive, right? So if you are able to integrate with primary care setups, build artificial intelligence to help them be diagnosed and be treated before the symptoms go evolve and you need to be admitted at the hospital and you are at risk of dying, it's a very powerful tool, which is very simple and fits with the current needs of the current healthcare system.
It can change your life as a patient, and it can also change your life as a healthcare professional.
Yep.
What I see, Manu, from your experience are two things. One of them is that you have come back to the basics of research in order to get to public funding from the European Commission to boost your startup. And this is something that the European Commission is doing, funding research. So sometimes we need to go back to basics in order to get funding for our ideas, for our technologies to change such an important and disease area. And second of all, cardiovascular health can be changed, can be challenged by technology. Then Silvia, are you talking at global level, OECD, then in European Commission about healthcare? Is healthcare something that concerns our regulators, and which are the barriers that you're finding?
Yeah, we talk a lot about it. I can tell you that in one of our last meetings, we were talking about the health of the veterans, the people who were with problems with their minds, and they are using immersive technologies and artificial intelligence to give them mental health again. And we are talking a lot about that, accessibility for everyone. And
because that's something that is a concern. How do we provide equitable access to digital healthcare?
Yeah. For everyone, everywhere, not
everyone
only
everywhere.
in the OECD. And this is very important. It's a huge concern for us. There is money, there is regulation, and there is a huge concern about how and what to do.
That's nice to know. Then I want to know something about the audience before we jump into conclusions. Can you raise your hand if you're working in the healthcare arena? If you're a healthcare professional and a startup working in healthcare, something related to well-being. Okay, so we have some people working in well-being. There are two things that I want to discuss with you. One of them is, if you're working in healthcare, you know that the arena, the challenge that we are tackling is quite big. We need to transform healthcare systems for the better. But there are so many other sectors that are influenced by healthcare. We could impact healthcare from many other sectors. We can impact healthcare from technology. We can change healthcare from many other sectors. That's something that I want you to reflect on, and also on the barriers that those people in the audience might be finding when trying to do partnerships. So if they want to find a partnership in the healthcare sector, and they are looking for partners, and they are looking at the states and saying, okay, what should I do to establish a partnership or an ecosystem in order to boost my idea or my startup? What is the barrier? What they should do? What is your recommendation to them?
I can go. One of the things that has helped me many times in my life, and I think it can be applied to any sector, is building a partnership is many times challenging because you need to align your product roadmap, your own strategy, with the product roadmap or the strategy or the KPIs that the other partner is measuring and they care about, right? That's the first one. What has already worked many times for me in the past is what I call the photo finish. The photo finish when, like, at least running a marathon or at least running a 100 meters during the Olympics, we are going to see many of them. At the end of that race, you have a photo finish on who is winning, right? You remember that final picture of that. And I use that metaphor to, anytime we try to build a partnership is, I try to go at the beginning to that thing, what the photo finish might look like. And once you have a clear picture of that, then you build the rest. You know the work package, who is going to own what, what's the technology we have to build, what are the milestones, what are the deadlines. But you have to be clear at the beginning on what we expect from that and how we can create value for all of us. If it's a partnership of 14, you need the 14 institutions getting value from that photo finish. If there is 3, value from that photo finish. But many times people go to the conversation, they go to start talking about what has to be done since the beginning, what to the task part of the story, instead of aligning on what's the final goal of that. And that's how I think you can build partnerships in an empathic way, understanding what are the trade-offs and what the rest of the members need to be successful.
Really nice piece of advice. Silvia, what do you recommend to our audience?
Do you know what is the most powerful emotion in Europe and also in Spain, of course, but in Europe? And this is a problem for partnerships. Fear.
Fear.
If we feel fear, no partnership, not innovation, not progress, not everything. So if we want to go ahead, no fear, please. That would be my recommendation. Or at least be very attentive to that and try it not to stop you.
Any other recommendation you want to share, Silvia, from European Commission? What is coming?
Yeah, study a lot.
Study.
Everything is changing. We have to go.
We need talent. That's something that you always say.
And we need to do a lot of research, and each of us, we have to be studying, recycling ourselves all the time. This is very important, because if we think our knowledge is perfect and forever, we are done.
We are done. So do we have talent in the audience? What do you think? I think we have a lot. Do you have any idea, any dream? You've come to South Summit to dream out loud and to share your idea. Please stand up, and we will stand up, all of us, with an idea, with a dream. I will ask you, please, to stand up with your dream. Think on your dream. Think on the innovation idea that you've come to South Summit with. Stand up if you have an idea, if you have an innovation that you want to share. And think in 2 things. One of them, Manu told us, photo finish. Try to envision your idea in the world and how you can change it. Second idea, you can have an impact in healthcare. You can have an impact in health. Dream about it, add health to your idea, come to AstraZeneca to collaborate, go to Eindhoven, check what they are doing, and please take care of the regulation and keep updated on the talent that we need to change the world. Thank you very much.